the bed is made, I always start with this for my first step of the day. I just feel like having a made bed makes your room look so much better, and it's such a good way to start the day with a goal. So that is definitely one of my morning habits that I've been doing for a while, and I absolutely love it. Let's go get our coffee. Toasted Southern Pecan is Smartest coffee flavor. It smells super good. So I'm gonna mix up my creamer here. Good morning, friends. It's time to wash our face and get ready. So I'm gonna use my favorite La Roche-Posay oil cleanser this morning. This is what I always use to wash my face, just to get a fresh base in the morning. It's this one right here. I also use it at night to take off any of my makeup, and it's so good. And then for morning skincare, I'm going in with my favorite duo. This is the Paula's Choice Advanced Replenishing Toner. I take a little bit of my hand and I just start to rub this in everywhere. I do make sure that my face is a little bit damp too. And then if you have any swelling in your face from overnight, you can gua sha just to get a little bit of any of that edema in your face. Next, going in with the La Roche-Posay. This one is the Double Repair Face Moisturizer, and I'm just going to go in with a generous amount of this. Again, massage it in quick, and we're gonna let it dry for a few minutes before I start my makeup. I think today we're going to do a slicked back hair look, so I'm gonna brush through with my favorite boar bristle brush, and then maybe I'll do even a slick back bun. That honestly might be really cute. So we're all dry shampooed. I might add a little bit more in some areas that just feel like they could totally use it. And always brushing that in. Also, before I forget, deodorant. Hair ties are the, I think these are Kit Check telephone cord ones. I think that's how you pronounce it, but I'm just going to brush this back, and then if you want it to be super smooth, boar bristle brush, you can always add in a little bit of product. I have the Day Styling Cream definitely on my list of stuff that I want to get, because I just can't fathom putting wax, hair wax, whatever it is, just like that stick of wax. I feel like it would just never come off of my head, and then you would only be able to do that on days that you are like 100% going to wash your hair. Otherwise, it doesn't make any sense. You can't return from that, where I feel like at least the day one, you could definitely come back from. So, to make this even easier for today, we're going to just pop it into a little braid. So I'm just gonna split this in 3, braid on down. Is what we're left with. Time for makeup. Sorry if you guys can hear my fan, but it's so hot in here in the mornings when I'm getting ready, because we don't have central air. So it is something that we just recently installed, and now I quite literally could not live with it. By curling my lashes and tossing on some lash primer so that can start to really harden. I like to wait for it to be drier before I'm actually doing my mascara, which is fine because we have to do our entire face of makeup yet. So because I need to be done with my makeup in 10 minutes, we're gonna do really quick makeup today. So because my under eyes are continuing to be popping with those purple undertones, I'm gonna go in with a demi shade first, and I apologize, my mirror is over here, so I'm gonna be definitely looking this way. And we are going to color correct the under eyes. I'm gonna let this warm up for a minute or two. This really kicks the blue purple hues a ton, and with me wearing blue today, they're just very pronounced. Today is Thursday, which means that it is a clinic day for me, And Thursdays are definitely my busiest days in clinic. So we start seeing patients at 9:30 and then we end somewhere between like 4 to 5 o'clock, hopefully sooner than 5 o'clock, depends on how we get scheduled and really how the day rolls. I'm going in with Palace, this pinky color next. This is also a brightener color correction shade. Right now I'm using June, and this one also has some color correcting for redness in it. It's so perfect and the best makeup, especially for my long shifts. So in a normal clinic day, I'm doing anything from triaging, answering phone calls, we'll just room patients, we'll put in their orders, give them education, go over surgery scheduling information, we'll give them our protocols and supplies for surgery scheduling, and it's pretty busy. We see patients every half an hour, so especially when both providers are going, it can be happen. And then we send messages for the surgery scheduling. We basically do all the check-ins for clearance and all that. So we are a busy team. I just got another nurse that's part-time added on because before then it was just me and someone rooming. So now we're tag teaming, learning our new little flow of things, and I'm getting her trained, which is really nice to have someone to cover my lunch breaks. You wouldn't think that clinics would be sometimes that busy for lunches and stuff, but when you only have a half an hour for lunch and that's all you're scheduled for, by the time the first patient before lunch is done seeing the doctor and then you need to room the next one, it can just be craziness. But I work with definitely an older population of nurses, and I do like it because they're all really experienced and they can answer a lot of my questions because I am technically still a newer nurse. I mean, I've only been doing this for 4 years now, so their support is amazing and I am always learning more. And obviously with them having like 40 years of experience on me, it's ideal. I really hope we start to get some more younger nurses in there. I think that would be so nice, not only for like the social aspect, not that it's about that because they're all really nice, but just like, I don't know, when people start to retire and everything, it's scary to think that there would be like no experienced nurses in that whole entire section. So doing some bronzer and we'll do some blush. I usually am not this quick and aggressive on my makeup, but for the sake of time today I have to be. Just some Hollywood with a little carousel. I love this blush combo. If I could douse my face with blush and it would be acceptable for work, I would totally do that. I am in a blush craze lately. Back to the brows. And last night I meal prepped some extra taco salad bowls, and those are going to be delicious and quick. I love myself when I pre-plan what I'm having for lunches and I'm not just doing cottage cheese and fruit like I have been doing the last couple days. Topping with a little highlighter, because that's definitely the vibe of our look today. And back in here to my brow wax with some setting spray. Told me that I would be a clinic nurse for vascular surgery when I first graduated. I think I would have told you that you were absolutely insane at the careers that I made, because I really thought that I would always be inpatient for honestly like life or for a long time. That's all I knew, and that is truly like what I loved coming out of nursing school. A lot of the inpatient nurses would kind of like crap on clinic nurses, and I think because they think it's just like bougie, cushy, which it totally is. Like, not working weekends or holidays is fantastic, and I would definitely choose that over the crazy hospital, anything. Got that crazy unruly brow hair. Now we are going to do some mascara. For perfume today, I'm going in with the Dime Beauty. This one is Felt Cute. Love this. And we'll probably drown ourselves in it because I love it that much. And then for smoothie, we're doing some ice. I have some fruits. These are looking a little rough from this weekend, but it'll be fine. We'll do some plain Greek yogurt. And then, of course, my Clean Simple Eats. And I'm gonna do a full scoop of protein powder, a little water. My smoothie turned out. I have my lunchbox with my taco salad and everything in here, and I'm gonna head inside to work. I'll catch up with you guys on my lunch break, and hopefully it's a good day today. Okay, you guys, the lighting is absolutely awful in my garage, but it has been an absolutely crazy day at work. It is 6:15 and I'm just pulling into home. So usually I get done with work at 5, but it was just a lot later today. I didn't get a lunch break, so can't really show you guys that. I just ended up eating at my desk while we were in clinic. But if you guys like this vlog, definitely make sure to subscribe. I'm planning to hopefully continue to do these, and maybe I'll do one like once a week or so. So thank you guys so much for watching and being here. I appreciate it. And if you're also a clinic nurse or a nurse in general, want to be a nurse, nursing student, leave a comment down below. And I'd love to hear what you guys are all doing, what careers you're in, what you love. Thank you guys so much for watching, and I'll see you next week.